There are close to 650 long-term care facilities in Ontario, so the magnitude here potentially huge. Laura Tamblyn-Watts is my guest. She's the CEO of CanAGE, an independent nonprofit advocacy group that works very hard on behalf of Canadian senior citizens. Laura, good to have you with us here on CTV News. Your thoughts on this report?
It's a terrible day for Canada. I challenge anyone to read this report, not to put their head down and weep. We've got cockroaches, we've got flies, we have seniors who have fallen out of bed, and we have the military whose job it is to work in war zones say that they're shocked. I mean, if something doesn't change now, I don't know what it's going to take.
And I'm curious why you think this is potentially only limited to 5 places. I mean, it strikes me that there could be a lot more going on, not just in Ontario, Laura, but across Canada.
We know for a fact that in Quebec we saw, the Résidence Herron, where people were left for days without food and water. So we know this is certainly not unique to these 5 homes. We heard the Premier say that he's aware that it's happening at other places as well. It's true. I'm not saying every residence in long-term care in this country is in this state, but many are in this state. And while it's true that he may be shocked and sorry, it's also his responsibility.
Yeah, how could this happen, Laura? I know you follow this very closely, and perhaps sadly you're not all that surprised to read what's in here in black and white from the Canadian military, but what's going on?
We have been cutting back in the area of seniors care and elder abuse response and public health and vaccines. What do you think is going to happen, and how much more is it going to take before we reinvest in the things that we know we need? We know we do need an inquiry, not a commission, and we know that we need to support people to be able to participate. What happens in these types of inquiries or commissions is that the very voices of residents, families, and advocates don't get to the table because they can't afford to participate in it. How did we get here? We stopped funding and we stopped caring.
So cuts to budgets, low pay for the workers, poor training in some cases as well, and perhaps sort of a societal neglect where a lot of people are perhaps not interested in hearing about this stuff because it's uncomfortable.
We other older adults, right? We put people away and don't look. Ageism is the most prevalent form of discrimination in the world, so says the World Health Organization report in 2017. And we see that playing out here. I challenge you, what other group would we allow this to happen to in Canada, to have reports on this time and time again, and no action really gets taken? So when we hear the Minister of Long-Term Care, the Minister of Health, and the Premier say how shocked and sorry they are, I feel for them. I believe that's true. On the other hand, there is also a predictable outcome when you do make cuts to public health, when you don't give people the vaccines like shingles vaccines and pneumonia vaccines and flu vaccines, when you don't make sure that there's dollars to restore homes that are neglected or build new ones that are smaller and safer.
We're going to show our viewers the 5 in question again where the military were deployed, and these are the 5 that are in this report that we're talking about with you, Laura, right now. And they are in different parts of Ontario, but of course mainly within the GTA, the Greater Toronto Area. Who bears responsibility for this?
Ultimately, it's always the government, but I have to say that it's really our social responsibility as well. There are dollars and attention given to things that matter to people. And really, older adults have not necessarily mattered to people in the way that has caused investment and change. So if nothing good comes out of this, can we please start taking action to fund seniors, to fund the field of aging, to make sure that the organizations that deal with abuse and neglect aren't working dollar to dollar, day to day, which is what they are right now? We can change these things. We just need to have the desire to do it. And this government has said they're going to change it to them. And I think Ontarians are going to hold them to account.
I mean, amid the chaos of a pandemic, we can understand there may have been issues with a lack of proper protective equipment. That was certainly a societal problem, beyond long-term care facilities and hospitals and elsewhere. But what about some specifics? I mean, when you think about force feeding, cockroach infestations, I mean, this is a whole nother level.
It's abuse, and there's no pretty other word to use it. And that word was included in the report. If you're force feeding people, if you're leaving them in their own feces, if you're not giving them water, if you're making it so that they can't get out of bed and that their skin breaks down so that they have pressure ulcers, it's abuse. And we need to make sure that we act swiftly to change it. And so for these particular areas of administration, we need to have a system that can respond quickly, but not just to these 5 homes. There are prevalent concerns all across this province, all across this country.
I'm also curious for you what needs to be done here for older adults. I mean, what can we do to try and stop this from happening again, to go in there and see what's happening at homes we haven't heard about potentially, and make sure this kind of thing ends?
At CanAGE, we're coming out with a policy platform for change in long-term care. And we're focusing on the changes needed to staffing, the changes needed to infection control, changes needed to infrastructure so the buildings that are falling apart get renovated. Right now in Ontario, we're going to lose 30,000 long-term care beds in 5 years because they don't have appropriate fire safety. We know that we also need to make sure that long-term care is not this separate other place that we don't look at, but that they're integrated into part of the community. There's something called emotion-focused care. It's not the medical model. It's about making sure that older people live healthy and active and engaged lives, no matter if they do need service provision. We can do this. That's the good story. We just need to start now.
Do you think change is going to come after we see a report like this?
I don't know what it's going to take. If we don't see that change is necessary and that investment and supports have to work in the area of the aging sector, after we leave people with cockroaches on them, we leave people with flies landing on them, and we leave people without food and water, what is it going to take? So I'm optimistic because we have to be optimistic. But remember also, a commission is not an inquiry. And we need to know whether or not we can compel answers, and will there be funding for residents, families, and advocates to participate? Because you could have a commission and not actually make it accessible for people to participate.
Laura, thank you so much. Some great perspective and some great information and some great viewpoints as well. We really appreciate it.
Thank you.